Good evening, everyone. Welcome to yet another episode of KIMSHEALTH Doctor Live. Everyone aspires for a very good and healthy skin because it helps to improve your self-confidence and self-esteem. Today we have Dr. Duaa Abdulmohsen, dermatologist in KIMS Medical Center, Muharraq, to discuss on dermatological conditions and treatments. Welcome, doctor.
Hello, thank you.
We can begin. Can you share a little about yourself?
I'm Dr. Duaa Abdulmohsen and I work in KIMSHEALTH Medical Center in Muharraq. Actually, I studied for dermatology in the United Kingdom in the UK. I got my master's degree in clinical dermatology, and I also got the Arab Board of Health Specialization Certificate in Dermatology and Venereology.
Once again, welcome, doctor.
Thank you.
Let's come to our discussion topic.
Yes.
Nowadays, it's very concerned. Everyone is that much very concerned about their skincare routines. And upon you, what products should everyone have in their list of routine?
Well, I believe that everyone has to have a good cleanser to begin with, because a lot of people use soap, and soap can be a little bit harsh on the skin. Especially when they contain perfumes or they contain hard detergents, they can be really harsh on the skin. So to have a good cleanser that actually suits your skin type goes a long way when it comes to skincare. So also, one of the most important things that you apply on a daily basis is a sunblock. So having a really good sunblock that has SPF 30 and more. And by SPF, it means sun protection factor. So by having sun protection factor 30 and more and applying it every day, you protect your skin from the sun rays, preventing not only skin cancers, but also pigmentation and accelerated aging. And third, last but not least, I think a good moisturizer is something that anybody and everybody should have. So having a really good moisturizer for both your body and your face is really important.
One thing, doctor, is it good to use the same moisturizer for the body as well as for the face?
Yes, this is the thing, because it's a moisturizer and it doesn't know where you're going to apply it. Yeah. So you can apply it anywhere you want.
But that is a major concern, and so many are very confused on using.
No, as long as the moisturizer has no perfumes and it is medicated and you get it from a proper pharmacy, then you can apply it pretty much everywhere.
Okay. Yeah. Many are confused. Many are confused when it is coming to taking a proper decision on what treatment to be chosen. What is your thoughts on using the fillers or injectable cosmetic treatments?
Well, to be honest, I love injectables, and I always elaborate that to my patients, that think of yourself as a grape, and as the grape ages, when it's young, it's plump and healthy, but as it ages, the grape has wrinkles and it loses its volume. So that when it comes to filler, but also when it comes to Botox, think of yourself as a leather shoes. I always say that. So the leather shoes, once you buy it, once it's new and young and healthy, it's clear and it has a smooth layout. But as long as you move and you use it frequently, the leather shoes loses it wears out and it has some wrinkles on it. So the same that happens with the human skin. We lose volume, we do a lot of movement, we talk, we chat, we laugh, we eat, we speak, and all that just affects your skin and your features. So what you can do, you replace the volume with injectables, as in fillers, and you also help with removing wrinkles with Botox. In that way, I think you prevent early aging and you get yourself a healthy looking young skin. So before, injectables were a scary thing because people were afraid that when they inject their face with fillers, they will look fake and people will notice that on their face. But now with the new products in the market, it's extremely safe and it's also very natural looking. So it's an easy procedure that we do in a clinic. It only takes like 15 minutes and you go out looking fabulous.
If you want to look very fabulous, you have to do something for your skin.
Definitely. Okay. Always take care of your skin because this is what you get throughout your life. You only have one skin and it's showing to people. So I think it's really important to...
The pain is for some time only, but you will get the
no pain, no gain.
Yes, exactly. No pain, no gain. When it comes to about the teenagers, their most important concern is the hormonal changes, periodic acne, and can diet really affect acne?
Well, yes and no, because a lot of people think that chocolate can affect their skin and can cause acne,
yes.
While now studies show that chocolate is healthy. If it's pure chocolate, it's healthy and it does not cause acne at all. However, there are some certain food that can cause acne or sometimes make your acne worse. So one of the food I can list is milk, especially our dairy, especially the low-fat ones. So low-fat milk, low-fat dairy can actually cause acne and exacerbate your acne. So if you cut your dairy or if you replace the low-fat with full-fat, you are more in chance to get a healthier skin. Also, high glycemic food, as in fried food and that is high in sugar, overall increases the chance of you having acne. So if you cut these two off, you'll be fine.
Upon your thought, what is the perfect fruit or vegetable or food item that we can include in our day-to-day lifetime for a proper and beautiful skin?
I love antioxidants, and antioxidants are found in red fruits, usually berries, strawberries, and
beetroots.
Yes, and beetroot, of course. Any red or like dark green fruit or vegetable, you will find the antioxidants in them, and that's really healthy.
Another major concern, not a concern, it's a very important doubt among everyone. Should or shouldn't we pop the pimples?
That's everybody's debate.
Yes.
Yeah. I'm gonna settle the debate. Well, if you don't want your skin to be worse, stop popping your acne. If you have a pimple here or there, just leave it alone. Don't play with it. Don't touch it. I always advise people to even cover it with some plaster or something. Let it be, because it will take its time and go away. Or you can treat it, but again, don't touch it. Because if you pop the pimple, you will get scarring. You get more chance to have pigmentation, as in dark circles around your pimple. And you will get it more inflamed. So you better just leave it alone and let it be until it goes away.
If there is a chance of having a very heavier pimples, consequently having frequently, then that time, is there any treatments to control our pimples?
Yes,
like that?
Yes, definitely. Because in a clinic, we take it step by step. So if someone has acne, but just a mild form, we'll start him on or her on topical treatment at first. That means creams and cleanser washes. If the pimples are recurrent, then maybe they will have to go into a higher treatment plan, as in oral medication or pills. That is antibiotics. We can include antibiotics, and also we can include isotretinoin. So these two medications we can give for people who have acne. If somebody by any chance have like this, one big acne pimple that, is very red and deep and hurts so much, they can always come to clinic and we can inject it in a clinic. That way it reduces the inflammation and the redness and the pain, and it will go away faster.
nowadays everyone is suffering from dark circles. Exactly, I have to say like suffering from because of the routines, the sleep routine changes, continuously working in front of the laptops. Even in kids also we are seeing this dark circles.
True.
According to you, is that to be treated? And is it necessary to take eye creams? Nowadays, in our markets, a lot of eye creams are also available. What is your concern on that? And please share.
Yeah. So when it comes to dark circles, there are plenty of causes that cause dark circles. And it depends on the cause. We have to decide on the cause and diagnose that in order to treat correctly. So dark circles can sometimes be caused by irritation, as in somebody having contact dermatitis or eczema. That way they will have dark circles around their eyes.
Yes, allergy can cause dark circles also?
Definitely, definitely, yes. Also, as you said, stress and work and looking at screens all the time and not sleeping enough, that also causes dark circles. And also when you don't drink enough water and you're dehydrated, that also can cause dark circles. And lastly, when you age, you lose volume on that area, just as you lose volume in any other area. And when you lose volume, we cannot treat it with any eye cream. It will not be treatable unless you inject fillers on that area. That is pretty much the only solution for dark circles if you have volume loss. When it comes to eye creams, I like eye creams when you apply them correctly and when you choose the right ones, and we prescribe them to only few people who actually need them because they have a dryness around their eyes. Otherwise, as I said before, you can just use any moisturizer and moisturize around your eyes as well.
And summertimes, the major concern of everyone is the tanning. It is something which we, as you said earlier. Okay, what about your thoughts on regarding the tanning?
Oh, if you love yourself and your skin, don't go tanning. Stop tanning, because once you're in the sun, you're exposed to the UV rays, as in UVA and UVB, the ultraviolet A and the ultraviolet B. And these two UV rays can cause tremendous damage to your skin. It can cause a skin cancer, it can cause pigmentation, it can cause accelerated aging. So avoid tanning always when you're either in the beach or in a vacation, or you're just simply going out in the daytime. Look for the shade. Just go under the shade, under the umbrella. Just be in the shade. Wear your long sleeves and your hat and protective eyeglasses, so that you protect your skin and eyes from the sun. And always apply your sunblock every 2 to 4 hours whenever you're out. And that way you protect your skin and avoid any damage that the sun can cause.
Actually, we have to take care and protect our skin like our baby, right?
Yes, definitely, definitely.
Another confusion maybe everyone have then. Is it advisable to use SPF specified sunscreens only if we expose to the sun, or if like we are traveling in a car and we are regularly going to office and regularly under air conditioned, then is it necessary to use sunscreens?
Well, yes, it is, because UVA can cross the windows. So if you are just by a window when you're traveling by a car, you are still exposed to the sun rays. So you still have to apply your sunblock before you leave your home. However, when you're in air conditioned and like inside a place, you don't have to wear your sunblock if you're not exposed to sunlight. But however, now some people have like an outside kitchen where they cook, and so they go out and in again from their house. continuously, and that way they are exposed to sunlight.
Yes.
So only wear your sunblock when you are going to the sun, you are exposed to the sunlight.
It's not only a matter of hot as how much we affect to
No,
our skin. It's
definitely.
also a matter of how much we are exposed to the sun, right?
Yes, exactly, definitely. Even in colder days, even if it's cloudy, the thing is we don't see the sunlight, the rays, the UV rays, we don't see it. We see the sunlight, but we don't see the UV rays by our own eyes. So it's not something that we can tell that it's going to cause a damage. That's why we tend to ignore it. And because sometimes we have darker complexion, we won't necessarily get a sunburn, so we will not feel that the UV rays in our skin. So it's important, even if it's cloudy, even if it's in winter time, it's always important to apply your sunblock and always reapply it when you are outside, and reapply it every 2 to 4 hours. Also, I'd like to say something. If you want to pick your SPF or sunblock, if you want to pick your sunblock, always look for broad spectrum on the label, because broad spectrum means it will cover all UV type of rays and it will protect you more. Also look for ones that are water resistant, especially when you wash your face often or when you want to go for a swim. It's important to use one that is water resistant.
Yes. So doctor, can you share your thought on, can stress cause hair loss?
Yes, definitely it can. And it's something called telogen effluvium in the medical terms. So stress together with pregnancy, if you lose weight, if you don't eat enough, all these things can cause hair loss.
As you said earlier about the wrinkling, and what is the age we have to start on using the treatment against wrinkling by ages and or the anti-aging creams and all?
Well, to put it in short, I advise everyone to use anti-aging products or procedures by their late 20s, because the earlier you start, the better results you get, and you prevent your skin from going really wrinkled and having more damage that is hard to treat later on in life. So if you start early on, and if you take care of your skin early on, and if you do like these procedures and put the right creams from your late 20s, in that way you prevent your skin from being wrinkled so soon.
So doctor, for a good and healthy skin, it is necessary for us to follow a regular routine for our skin, as well as healthier habits and proper care for our skin. That's what you have shared with us. Doctor, can you suggest a proper routine or suggestions that can share with our viewers for a proper skin care as a whole?
So you should always take care of your skin, whether you're boys or girls, males or females, young or old. Always take care of your skin and stick to a skin routine that is not too complicated, but something that you can carry on a daily basis. You have to apply a sunblock whenever you're out in the sun, and also moisturize every day. Choose a cleanser and stick to it that is gentle to your skin and does not have any perfumes or chemicals in it. 2022 is the year of skin boosters, as they say. So there are a lot of injectables and skin boosters that we do in a clinic that can hydrate your skin so quickly, instead of using creams that can take so long to have the effect on your skin. So if you have any dermatological issue or concern, you can always come visit me in a clinic and we'll take care of your skin.
Thank you, doctor, for sharing all your thoughts and advices and suggestions. It was a great time we are having you here.
Thank you so much for having me, dear. Thank you so much for the invite.
Thank you, doctor. Good and healthy skin is everyone's dream. Follow a healthy routine and take care of your skin. Stay healthy, stay happy. This is Shine Susan Saji signing off.